Thank you, everyone. So in this presentation, I'm just going to outline some of the ways in which Choosing Wisely is helping to support antimicrobial stewardship through implementation of their recommendations into NPS MedicineWise and other activities. As we're all aware, antibiotic resistance is a serious issue globally and it requires urgent coordinated action across all sectors in society. Australia is one of the highest users of antibiotics in the world, and several colleges and societies through the Choosing Wisely Australia initiative have started to develop recommendations to help address the overuse of antibiotics and related tests. Currently, there are 13 recommendations that have been developed that are of relevance to both primary and secondary care, and they cover a range of areas including the management of upper respiratory tract infections and ear infections, bacteriuria and urine testing, skin conditions, and addressing the duration of antibiotic therapy and review. NPS MedicineWise has been delivering a 5-year program on reducing antibiotic resistance for general practitioners, consumers and other health professionals. And 4 colleges and societies have developed Choosing Wisely antibiotic recommendations that are supporting the key messages and activities of this program, which currently in this year relate to avoiding routine prescribing of antibiotics for upper respiratory tract infections, avoiding testing of urine in older people who have no clear symptoms of a urinary tract infection, and avoiding treatment in certain groups of children with otitis media, and also avoiding treatment in asymptomatic bacteriuria. One of the ways in which NPS MedicineWise is helping to implement these recommendations is through education and support for conversations around antibiotics. Each winter, NPS MedicineWise runs a campaign to educate the community about appropriate management of respiratory tract infections. To support education and symptomatic management and conversations around antibiotics at the time of potential prescribing, various resources for general practitioners and consumers have been developed, including a respiratory tract infections action plan for symptomatic management that is designed for GPs and consumers to work together to develop a plan for symptomatic management rather than antibiotic treatment. We've also developed consumer information, particularly for parents, around managing coughs, colds, earaches and sore throats for children, and have developed a range of other online content and publications such as MedicineWise News on various topics related to antibiotics, and also developed a number of continuing professional development activities for health professionals, including the topics of otitis media and urinary tract infections. And for the otitis media case study, we actually decided to do that following the recommendation from RACGP. Another way that NPS is helping to implement Choosing Wisely recommendations is through audit and feedback. This year, feedback will be sent by us to GPs on their ordering of various urine tests on the Medicare Benefits Schedule, or MBS, and will incorporate the Choosing Wisely recommendations on asymptomatic bacteria and urine cultures as reflection points on practice. Austin Health is also undertaking a range of behavioural change activities based on the recommendation from RCPA for urine cultures, and these activities also include audit and feedback, along with education and peer support, particularly for nurses, updated guidelines and decision support. NPS MedicineWise have also developed a clinical e-audit for GPs for them to reflect on their management and areas for improvement for a range of upper respiratory tract infections in the selection of patients. On a final note, in 2016, Choosing Wisely Australia took part in the Global Antibiotic Awareness Week for the first time. Colleges and societies involved in the development of antibiotic recommendations were invited and participated with NPS MedicineWise in communications during the week, including general and social media, that encouraged all to use antibiotics responsibly and promoted the Choosing Wisely Australia recommendations related to antibiotics that were available at the time. As part of this event, antibiotics resources pages for clinicians and consumers were created for the Choosing Wisely website, and these can still be found on the resources pages if anyone's interested in having a look. Thank you. Short and sweet. Thank you.